Veterinary Dermatology, organized by Association of Veterinary Dermatology. Today we are in Hayat, Pune, and we have an impressive number of small animal practitioners coming here from across India. Come, let's see what's happening here.
I've been delighted to have been invited to come to India to participate in this absolutely incredible veterinary dermatology event. I cannot praise enough the people who've organised this, and I have been blown away by the sponsors. The sponsors' generosity has made this all possible. Without sponsors, we couldn't put on educational content like this. Without sponsors, we wouldn't be able to push forward veterinary dermatology in India. So I am delighted to have been invited to come and spend some time here.
So this Congress, Indian Congress for Veterinary Dermatology, 4th Dermatology Congress we are conducting. So in this 4th Dermatology Congress, our theme itself is antimicrobial resistance.
Okay, I mean this is a congress like this is very important, okay, because most practitioners in India are all general practitioners. We do not have any specialty. So most why we want to change from symptomatic treatment to a very precise diagnosis and a very systematic approach in managing the dermatological problems. Because in small animal practice, 50 to 60% of the cases they deal with the skin. Many times they lose their clients because of a very kind of a spot diagnosis, not going very systematically. So obviously Congress like this, it will sensitize them to make approach a case very systematically, and so use the right products which are backed with evidence. And obviously it is a long way to go, and so that will make the owners happy and the veterinarians happy, and the practice also will grow. Yeah.
Around the world are being brought here, and we have to learn a lot from them, the latest techniques, the latest developments, and the latest research also we are getting to know of it.
This is the first time where ICVD is only dedicated to dermatology. We have a lot of presentations, lectures, and we have speakers who are dedicated to dermatology. So it's much easier, the topics are more concise, it is more target specific, so it's much better for us to focus on dermatology specifically and not other subjects.
Well, dermatology is a major concern for all practices, and I would say about 50% of all our cases are dermatology, and so such conferences are really helpful.
In the organizing these kind of programs from a long time, this is the 4th ICVD we are organizing. Definitely we are focusing more on dermatology, which is really very, very important in the clinics. And every day almost see the most of the cases what we get in clinical practice is almost all the dermatology cases.
See, we attend these conferences to upgrade our knowledge and skills so that we can use it in our clinic and make our clinics more efficient and more diagnostic prone, and that will give us better results for the treatment for the patients.
What they are trying to point out is a new approach, some changes in the perception of the veterinarians towards treating dermatology. It's not because many of us just think of dermatology as any other disease, whereas it is a much more complicated process which requires a broader view.
It is an antimicrobial resistance that is very, very important. It has to be followed by all the vets because it is a upcoming thing. Initially we didn't have knowledge about the methicillin resistance or anything. Now we have got a lot of resistance for a lot of antibiotics because of improper use. So they have formed the guidelines. In all the scientists in the world, they have formed the guidelines how to use an antibiotic, and it is they concluded that better to go for a topical therapy. If it is not improving, then only you have to go for systemic therapy.
In India, we use randomly many antibiotics in simple surface pyoderma, superficial pyoderma.
Right now, there is a lot of hue and cry and the problem which is related to antimicrobial resistance, and we need to shift our focus from the cidal agents, that is therapeutic agent, to the management agent. Sometimes nutraceutical kind of agents. And when you talk about the skin, the most important is the skin barrier. If we can strengthen the skin barrier, we can fight many of the diseases.
Recently, we have been doing a lot of diagnostic tests regarding skin infections and ear infections, and we are getting better results.
So actually here we have got a lot of allergic dermatitis in India. Actually in India we have got food allergy, environmental allergy, and also flea allergy, like that chemical contact allergy, like that. We have got very many allergic diseases.
So most why we want to change from symptomatic treatment to a very precise diagnosis and a very systematic approach in managing the dermatological problems. Because in small animal practice, 50 to 60% of the cases they deal with the skin.
If the dermatology is properly maintained or done properly, the clinic definitely will improve, no? Because almost we get around 40% of our cases are derma-related cases only. So definitely you should be a good dermatologist to run a clinic.
10 years before, there wasn't much of a specialty practice. It was like a GP. Now people are looking at specialists in dermatology. So
60% cases that come to our day-to-day practice is all dermatology. Where we generally used to have umbrella treatment. Now, fortunately, after these all conference and these congress, it's little changing, and we are having a little good time where we are also changing our outlook towards whenever the skin patient.
I've been practicing for the last 40 years now, and the practice has evolved like anything. We had nothing when we started, but I mean, the range of products, the exclusive products that are available for veterinary now is changing, and so I mean, I'm happy that things are changing for all the pets.
Doctors, at least about 50% will be dermatology cases. And we see the results, so owners will see the results. Owners are happy, doctors are happy, that's good.
Majority of dermo cases these days, say from March to October, are really scabies, mange, sarcoptic, sauroptic, as well as dermodactyl.
more concerned, pet parents are more concerned about side effects of medication. So now, so some holistic care should also be there, and some, I think some medications like in glycolipid form and all that should come, which have very minimal side effects or no side effects. So that thing should be considered.
Veterinarians now showing interest over dermatology, and they are getting the knowledge of dermatology, how to tackle dermatology cases, and we are developing our clinics and hospitals to treat the dermatology cases.
The industry are evolving, research also is evolving.
Atopic dermatitis has come into being recognized as a very major problem in the last 4 or 5 years. From being pets, now they have become a part of the family. From being owners, now the owners now really describe themselves as pet parents. So that change in the status of our patients has enhanced the status of veterinary professionals.
I think it is very, very important to reduce the oral medication for a client, because the client compliance gets short when you are writing too many oral medicines.
So my research work during the master's and PhD was on skin only. So this is how I got interest into this field, and I got to meet Dr. Nagarajan sir, and I became part of this association. And since I know how vast this field is, earlier honestly I have seen a lot of changes over the years into the field, because earlier how we used to deal with the cases and how now people are dealing with the cases is way more different.
Is the main theme where we have to focus. So the topical therapy, either it is a shampoo or mousse or anything, even the lotion, So those things will be very much helpful in treating the cases.
SAVAVET, okay, I know Karthik for a long time. I think it's a great, in terms of bringing innovative products to India through products with a strong science behind any products. So one of such product is a Dermoscent, okay, which I've been talking about that in my presentations as well. Most people found it useful. And so I use it for all atopic dogs and all the dermatological cases where I need to improve the skin barrier function, because it's a product which has been validated, and it is a very convincing results.
Like us. So we look for varied products with various concentrations to be used in various conditions. So definitely it is a great breakthrough in India with regard to dermatology.
I'm very happy with the products of Cutis, the SAVAVET products, especially Atop 7 shampoo, and I am in love with Atop 7 and Essential 6 spot-ons.
SAVAVET is already doing a lot. I mean, they know what we need in the market, what shampoos, what sprays, what tablets, what are the products we need for the upgradation of the practice in India. So we're almost on par with the Europe or American, where we have these products which are actually importing is not easy, and we're very, very thankful to SAVAVET for getting these products for us. Using from the day one the company has launched these products. Especially we are very happy with these products like Atop 7 shampoos, Atop 7 Spartans, and even the clients have given me very good feedback about Essential 6 Spartans, and all the range, even the moisturizers, the creams, almost all the products are excellent over there. Quite a good product, value for money, value for your efforts. Dogs are happy, owners are happy, so it's very, very good product to maintain these allergies actually, quite good products.
Very good product, gives instant relief and maintains that relief for the next few weeks also.
I love the products. They have very good efficacy, and especially Pymobendan I am still using. There are so many companies which have brought Pymobendan, but still I am using only Sava's Pymobendan, and the other products are all there with me. So I am a big fan of the products.
So in which condition we need to use the antibiotic, in which condition we don't use antibiotics. So we have to be aware about that condition, and many Indian vets, they should aware about these conditions, where to use the antibiotic, like cephaloxin. You have a cephaloxin through SAVA. So I think like in surface pyoderma or superficial pyoderma, they don't need the antibiotic, just the topical therapy, like we can use the topical spray for that, and also there are few products like essential fatty acids, we can use that products also in that condition, just to prevent the epidermal barrier.
I'm very happy with the evolution of products and the lead that companies like Sava have taken, introducing new products which have really benefited my patients, and Essential and all these products that have been introduced. They have really benefited all our clients. Clients are coming back requesting more products. The spot-ons are very, very good. And I think Sava is really helping the veterinary world and support Sava.
Yeah, for example, I can say this Nilura, the project actually before launching this, we have used this as some project work. It's working very well. I think we have given the more than 30 number of dogs, and we have observed the result. We have taken all biochemical results. So it's working good. The product is nice.
So that change is reflecting in the new products. So many companies coming in, so many new products that are being available in India as soon as they are being available in the Western countries. So Cutis, as I say, the Dermoscent products, they have got a high potential regarding the maintenance. But
so one of the current literature, especially the ICVD guidelines about dermatology, specifies that use of oral antibiotics should be restricted as much as possible. And the evidence-based studies also put it on the record that topical supportive skin elements or applications start doing wonders in supporting the oral medications. Fortunately, Dermoscent is one of the very well-known brand, and Sava acquired it, and it has got a full range. I mean, we deal with the pyoderma with the dermoscent range, we deal with the seborrheic dermatitis with dermoscent range, and we deal with finally with the atopy with the dermoscent range. I personally feel that it has a tremendous role in going to come in one health part of it, because we are safeguarding the owners from avoid using the antibiotics.
But yes, supportive management is very important in these diseases, and these photons has helped me a lot. And
I am very happy to be a part of IVAD, and also very thankful for Sava to help me be a part of this conference.
You guys who support the industry, it's been a good progress, and we would like to continue doing this.
ICVD programs, it's very helpful in our practice, definitely.
We were dependent upon very few medicines, no specialized medicines for dogs sometimes. So we have to pick and choose the medicines from the human medicines, or there were combined medicines for bovine, and equine, and also the canines. Dermoscent has lots of product which will cater to increasing the immunity of the skin, strengthening the barrier of the skin. I am focusing on ETOP 7 and there's one very good product which is a massage oil, silver massage oil. I like this efficacy. And Essential 6, these are the products I am targeting on, along with that ear cleanser, Bio Auto. These are performing very well.
I am very happy to say that skin and dermatology has changed so much in what we were doing last 30 years when I started as a student and a new practitioner.
How we should, demarcate the case for superficial pyoderma, or it's a deep pyoderma. In few cases where we thought that it's mandatory to use antibiotic, so that's very clear that only with a topical application we can treat many of the dermatology cases.
They are reluctant to go for some kind of test, especially in case of dermatology. Skin scraping and routine microscopy is still okay, but sometimes if we require any kind of skin biopsy, then owner most of the time they don't consent for that.
Now, 9 out of 10 cases honestly that we see in day-to-day practice are derm cases. In the past, it was lack of quality products, and the ones that were really good were kind of almost unaffordable, so money was a constraint back then.
So in the clinical practice, we encounter a lot of cases belonging to skin infections, pruritus, itching cases. So it's the most common problem encountered in the field conditions.
स्किन के आजकल नए केसेस आना चालू हो गया है, जैसा कि स्किन एलर्जी हो, इचिंग हो, सर्कोप्टिस डेमोडेक्टिक मेंज हो, उसके बाद में पायडर्मा हो.
Lot many pruritic cases are coming nowadays. Actually, it's a problem since long, but nowadays we are getting more and more prone breeds, disease-prone breeds like Shih Tzus, Golden Retrievers, Beagles. So that's why we are getting more pruritic cases, which are probably due to atopic dermatitis, food allergies, or some infection related.
In the recent few years, it is people are suddenly realizing that it is a specialized requirement, not just an umbrella where you can give everything and hope that it resolves.
Happy to have SAVAVET here for us who are into good skincare products, especially their atopy mousse, atopy shampoos. I think they are doing very good.
The products are really good, and in the conference also about from the international speakers, we have learned that they are also practicing essential oils, EFAs in their practice, and which we have seen in Dermocent range. So it's quite a good essential oil-based products. And in otitis, they said that it's not always important to instill antibiotics because sometimes we can ruin otitis case, in which Pioto has worked really well. I've been personally using in most of the otitis cases and I've got very good results. And for the atopic cases as well, Atop 7 is a very good range, and the spray, the shampoo and the spot on is excellent.
A few products, especially like Bioclean Auto. So that's a very good product, especially where we can't give eardrops for a long term. We had a few patients which could not be given eardrops daily. So they used to come to our clinic, and weekly we used to put Bioclean Auto in their ear. And Atop 7 is a good product. Atop 7 is spray and is spot on. Apart from that, Essential 6 is also very good in promoting skin health. And Biobalm also, it's a very good product, especially for callus pyoderma. And apart from this Cicafolia also, it has some kind of, it's kind of very unique product.
And I want to give a special shout out to the cutis division of Sava. Companies like SAVAVET and the cutis division have brought in products, world-class products, which have great benefits for the patients. Things like flea and tick prevention and a lot of other cases like atopy. We are able to tackle them much better. These were our biggest hurdles earlier. There was very little in terms of ectoparasite management and atopy management. But now with great products and great companies supporting the industry, the options are very much more.
So most of them, they are almost, you have a dermatological range and even anti-infective injections also. Then shampoos, ointments, medications, they are available. So we are regularly using them, including your Nulura, chlorhexidine shampoos, then tacromylus, this one, ointments, those things we are regularly using.
I've been using Atop products, for atopic dermatitis, and it's been very useful, especially when your products, especially when you're using Pio products also, you have a specialty about regeneration of skin is better compared to other market products. The regeneration capacity of the skin gets better and better when you use cutis products. Bravecto, when it's the patent was over, I was expecting something from SAVAVET because I regularly use most of the products from SAVAVET. So I was using Nulura, and Nulura is one of the cheapest product in that range, as I feel, and I regularly use it. And also, our derma products, Dermocent products also. Compared to other things, it is affordable and owner friendly.
SAVAVET के जो प्रोडक्ट्स है, डर्मा रेंज है, वो पूरी ऑल इफेक्टिव है. और अभी नए जो प्रोडक्ट नुलुरा जो भी आया है, और टिक्स और डेमोडेक्स और सभी के लिए वो भी क्वाइट इफेक्टिव है. एक्टो एंडो पैरासाइट, ईयर पैरासाइट्स और बॉडी पर के भी पैरासाइट्स के लिए काफ़ी इफेक्टिव है.
स्पेशली न्यू लॉन्च योर न्यूलुरा इज़ वेरी इफेक्टिव इन एक्टो पैरासाइट्स and found very effective in mange, sarcoptic mange. So this product is very fantastic.
I am using for atopic dermatitis. I am using the shampoos and that's spot on. Sava is a very good company, and they are coming with a very excellent, good quality.
And yes, I've been very taken with Sava's line. It's good, it's very good. I would say that if you have issues and you, not even issues, you can start at first line also, you really won't face issues forward. That's the whole point about all of this. We are very, very happy with most of, almost every Sava product that we have. I have been a big fan of this and this Atop 7 and the Essential 6 and the cat Dermocent, which I am not finding. Great results.
Right now it is the topical applications which are the thing that one needs to follow, mainly because of the antimicrobial resistance.
Now we are facing one major issue that ticks and fleas got resistance to so many medicines which are available in the market.
Big takeaway is judicious use of antibiotics.
There is an increased problem of antibiotic resistance going on, antimicrobial resistance. So to combat with that is very essential.
So all skin infections looks alike. Sometimes differentiation it would be very difficult.
सब्जेक्ट है डर्मेटोलॉजी का, वो बहुत वास्ट सब्जेक्ट है, तो कई बार क्या है कुछ ऐसे टिपिकल टाइप के जो केसेस आते हैं तो उसका हमारे पास सॉल्यूशन नहीं होता है.
Especially in Kerala, as you know, we have a very hot and humid climate, so there are a lot of problems, skin problems. So the pet practitioners across Kerala, they are worried about the challenges in treating the skin problems.
Used to be earlier, so topical therapy is the treatment of choice in the initial stages itself. So
Many things that, having a proper strategy for the itch cases, and the most important is about the usage of antimicrobials, antibiotics. Like there is some kind of resistance that we are seeing in the cases. So, and also how to approach, what is a strategy protocol to approach an otitic cases.
A2P is a big challenging head scratching disease for us as a vets, for pet parents, and unfortunately the pet who is suffering, that is altogether a different ball game. Then the owner compliance is a bigger topic.
Multiple number of times we used to see more number of cat patients in comparison of dogs. So treating them is a big task, and apart from treating them, handling and restraining is a major task.
So in today's practice, what I've seen and what was earlier is that a lot of people are not known of what is skin condition, what is atopic dermatitis. So I guess today that scenario is changing and people are aware what is atopic dermatitis, what is allergy, and they are going to the vet, upgrading their knowledge also, and doctors are also upgrading their knowledge.
सबसे इम्पोर्टेंट बात है, जितने जो पेट ओनर होते हैं, जो पेट्स पालते हैं, उनमें सबसे ज़्यादा टिक्स की प्रॉब्लम होती है, टिक्स, फ्लीज, लाइस की.
Using a lot more topical therapies as an alternative to some systemic antibiotics, which reduces the resistance a lot.
I have been practicing in the pet for almost 10-11 years, and I have been a huge supporter of Sava. In my clinic, I have around 25-26 products of only Sava. All the shampoos, injectables, and the medicine tablets, everything I have, and the results are excellent. Dermosins, I'll be using it definitely because I have read all the contents and how organic and how chemical free it is, and I'll be definitely using and be looking through how it will work in the future.
I was going through the catalog of SAVAVET, I came to know that you have created a sunscreen for dogs. What else is needed, So this is really amazing. So what is there for human? On par you get it for animals.
One of my client is very happy with the Poodle dog because of your newly launched this cutest range, easy brush shampoo gel kind of thing. So it has made the job very easy, and we have so many Shih Tzus and Lhasapsos, and then their coat is shining because of your product. And also regarding this otitis cases, Bio Auto Clean, it's a game changer, I can say.
To Dermosine product, and we are using the Nodora also.
SAVAVET has been satisfied. We practitioners who are dealing with the dermatology products on day-to-day basis, daily, whenever there is any monsoon waste or environmental change, breed-specific problem, we faced a lot. But particularly about SAVAVET is that they have come up always with some innovative which has particularly, dealt and targeted the practical problem of pet parents. And as a clinician, it has always helped me. The molecules which we need in dermatology, which we read in a textbook. They come up with that, so it's really satisfied.
Which you have a gazillion products in market, and you guys also have a lot of products.
It is working very nice, and towards this dermatology also you are giving best results.
So I've been using the products and it's really great. I've seen a lot of results with it, so I will definitely recommend.
तो उन सबको बचाने के जितने पेट ओनर्स हैं उनमें एक न्यू लूरा करके जो टैबलेट्स आई है बहुत ही अच्छी हाईली इफेक्टिव है। हम अपनी क्लिनिकल प्रैक्टिस पे भी हमारे साथ के ग्रुप में जो लोग हैं वो लोग भी बहुत यूज़ करते हैं। इसका इतना अच्छा इफेक्ट है, देने के बाद ही 3 घंटे के अंदर से टिक्स, फ्लीज, लाइस हट जाते हैं, उससे इचिंग रिफ्लेक्सेस भी होते हैं वो भी कम हो जाते हैं। सबसे इंपॉर्टेंट बात है क्योंकि जो टिक्स जब हटते हैं तो कई बार इचिंग होने लगती है, तो इस मेडिसिन को देने के बाद में इचिंग रिफ्लेक्सेस भी खत्म हो जाती हैं। इसका कोई साइड इफेक्ट भी नहीं है इस टैबलेट का, सबसे अच्छा है।
Usually we see a lot of seasonal allergy cases, especially with chronic ears, otitis that have a lot of lichenification. So things like Hydra cream or even Pio-Auto, they are quite helpful in those cases. Because otitis, I think, is one of those types of dermatitis which is very, very frustrating for the pet and as well as the pet owner, you know. So that helps a lot. When it soothes the ear, it's quite helpful.